Good morning. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is Tuesday, December 14th, 2021, and thank you so much for joining us. We continue to do these Facebook Lives Tuesdays and Thursdays at 11 Central, and we keep getting a lot of questions. And as long as we keep getting good live questions from Chicagoans, we're absolutely going to keep doing this. So first of all, I wanted to mark that we are celebrating this week that it has been 1 year since the COVID vaccine first became available in the U.S. Tomorrow marks the date that we gave our first COVID vaccines here in Chicago. We will be doing a press conference, sort of a celebratory press conference, and continuing to share some data because there are parts of the city that continue to lag and some demographics we're working on. So we'll be doing that at some point tomorrow, probably out in the community. We won't be doing the standard present, a lot of data necessarily at the press conference, and so I'll be doing a little more of that today on Facebook Live. Most of it in response to a lot of the questions that all of you have continued to send in. So I think let's go ahead and jump right to it. As a reminder, you can put questions directly into the box below or use the hashtag AskDrArwady on Facebook or Twitter. And we'll start at chi.gov/COVID-, the daily dashboard. And as you can see, we're averaging 903 new cases per day right now. And that has settled out at really quite a high rate compared to where we were prior to Thanksgiving. If we go up here a little bit, oops, let me just zoom in on that. You can see that basically in these few days right after the Thanksgiving holiday, we saw by far the most tests and positive tests that we had seen, going all the way back to January here. But unfortunately, we've continued to see more than 1,000 cases coming in on each weekday. And then you can see always throughout the year, we see less testing generally happen on weekends. But this is a similar pattern to what we saw last year, and it is high. I want to note that the hospitalizations here, there's been a little bit of a delay in terms of getting the data in from the state. In fact, it is actually well over 50 new Chicagoans being hospitalized each day with COVID. I've asked the team to perhaps do some adjustments in terms of how that updating, because I think it can give people a false sense that, in fact, new hospitalizations are falling. And if you've been following this, often over the weekend is when there can be some delay. And so anyway, I just wanted to note we are more at the 50 plus mark, and you'll see that change probably with the update this evening. We're averaging between 4 and 5 deaths versus potentially 5 to 6 last week. Both of those are higher than we've been. Vaccinations about 14,000 a day, tests about 26,000 per day, and our positivity, because we're doing a lot of testing, still quite good at 4.2, but on the way up. I wanted to just, we'd gotten some questions in about who is being diagnosed right now with COVID, and I've got a slide on that in a second, but I wanted to show you how you can look at that. If we go to cases, and let's say we slide this over and just look at the last month, for example. So let's go to, here, November, all right, let's just do that. November, sure, 18 to December 13. You can choose whatever you want there. It actually will change here and show you what the daily averages are, the cumulative totals. So just during that time period, we've had almost 19,000 Chicagoans diagnosed with COVID. We've had 884 Chicagoans hospitalized with COVID, and we've had 102 Chicagoans die from COVID. You can also, if you click on daily average, it'll give you a sense over that, the current daily average that we are. And then if you want to look and see what's happening by age, for example, either by average or by cumulative total. Again, if we just look over that last month approximately, you see that we are seeing more cases in younger people, and that is primarily because of vaccination. So about 4,200 cases during that time period diagnosed in children 0 to 17, a little over 4,000 in the 18 to 29-year-olds, almost 4,000 in the 30 to 39-year-olds, and going down from like that. But you can see the hospitalizations really go the other way, where hospitalizations and deaths luckily remain quite rare among children. And then we see the risk increase with age. And so this is why we are extremely focused, of course, on making sure everybody is vaccinated, but especially people who are in these older categories, really wanting to make sure if you've only got 343 cases and those over 80, but 124 of them are hospitalized and 24 are dying, that remains a really high risk group. And you can explore here, these are by rates, and you can look at cases, you can look at hospitalizations here. So again, in gray here, these are our Chicagoans over 80, and you can look at it for deaths. So this is how you sort of explore, and you can do this for any time period. You can look at it by race, ethnicity, which obviously, given that we are seeing still lower uptake, especially among Black, Latinx Chicagoans, is concerning because if you look at the difference between cases, hospitalizations, and deaths here, by race ethnicity in Chicago, you see we actually have more white non-Latinx Chicagoans being diagnosed, but that is largely because of testing patterns. We are seeing more white Chicagoans seeking testing, including that's just been a pattern, and that's true across the country actually, that where folks are more vaccinated, they sometimes are also more interested in being tested. And so we do some controlling for that when we're looking at what the spread is of COVID. But what you see, if you look at hospitalizations, which again have been really in a lot of ways the most important marker all along, where people are getting sick enough, we are seeing just in the last month, among those 884 hospitalizations, 384 more than you would expect given population in Black non-Latinx Chicagoans, 236 in white non-Latinx, 171. So anyway, I encourage you can explore all of this. You can also look at cases by zip code, but also hospitalizations, deaths, what's happening there, testing rates. Vaccines you can look at by zip, but also in the same way, like if we look at race ethnicity here, for example, this is all ages. This is where you see that we're continuing to lag, unfortunately, in vaccination uptake in Black non-Latinx Chicagoans, and then that in turn gets reflected in hospitalization and death rates especially, but also in case rates. And that's one of the reasons we remain really focused on this. So, I encourage you to continue to explore this dashboard. This is how you can do it. We're making good progress. This is where you can look by zip code and explore further. So I wanted to use the opportunity to show you some slides to hit on a lot of the questions that you all have been sending in. So first, I wanted to mark two national benchmarks, unfortunately, that we've hit this week. More than 800,000 Americans have now died from COVID-19. And that means diagnosed with COVID-19. This is not an estimate. These are actual counts of people for whom COVID-19 is on the death certificate, from the doctor, from the medical examiner, et cetera. And the other benchmark is that 1 out of every 100 Americans age 65 and older has now died from COVID-19. And COVID-19 is now the third leading cause of death even for that age group, behind just heart disease and cancer. And part of the reason I'm putting this in here is I do continue to get a lot of you writing in and saying you still don't believe that COVID is real or that people are dying from COVID. And boy, do I wish that were true, but it's not. Chicago and Illinois are ahead of the nation in most vaccination statistics, but we continue to lag national numbers for vaccination rates in seniors 65 plus. It's the group I'm the most concerned about. So as cases are on the increase, we expect with holiday gatherings, we'll probably see even more cases. With Omicron coming, it's critical that anybody, but especially any seniors that haven't been vaccinated, do so now. I also brought, we'd gotten a number of questions comes in about, isn't this just like the flu? Don't Chicagoans die from the flu just as much as they die from COVID? And so this is just over the last year, if you will. So this isn't all the COVID deaths. We've had more than 6,200 Chicagoans die from COVID. But if we just look over, basically the EPIs ran it from December 4th to December 3rd, December 4th, 2020 to December 3rd, 2021. So after vaccine started to be available, we've had 2,535 Chicagoans die of COVID-19 during that year. And that is 6 times more COVID deaths compared to our 5-year median of influenza and pneumonia deaths. If you average over the last 5 years, 2015, 16, 17, 18, 19, we did not include 2020 because that was such an unusual year for flu in that it was low. But among those years, we typically have 420 Chicagoans die. And so, unfortunately, this is not the same as the flu, and I just wanted to give you the local data on that. Also, a lot of you writing in about what is going on around the world, so I thought I would share this with you. Across the world, we've had more than 268 million cases and 5.3 million deaths, given more than 8.3 billion vaccine doses, which is really a lot. And the safety data and the efficacy data continue to be very good there. 57% of the world's population, 4.4 billion people, have had at least one dose of vaccine. And if you look at cases, you see that Europe right now is really the prime in terms of where the surges are the greatest, but more in line with vaccination rates there. And that's what things are looking like. Here in the U.S., for our travel update advisory today, no states have been able to come off. The country is surging again. California and Mississippi went back onto the travel advisory, and no states were removed. So you can see there's just a handful of states, and these are the ones that were hit the hardest with Delta over the summer. And so, we know, especially in the 3-month and probably to an extent the 6-month period after that, there does continue to be some level of protection, thank goodness. And so there is worry, especially in those parts of the country, as we continue to learn about Omicron, which especially for people who are relying on, so-called natural immunity, we're worried about it. But regardless, this is where we are. And if you look at sort of the national picture in a little more detail, you see that really all around us, again, darker here means average higher daily cases per 100,000 people in the past week. And this is cases. So this has partly to do with testing. There are parts of the country not very far from here that have positivity rates well over 10%, 15%. And some of that has to do with people not wanting to test. But it's one of the reasons we compare hospitalization rates too, because some people who don't believe COVID exists also don't want to get a COVID test. But if you're getting hospitalized, you're getting a COVID test. So in any case, nationally across the whole country, we are averaging 35 daily cases per 100,000 people. That's not great. Illinois is at 56 daily cases per 100,000 people, and Chicago is at 33 daily with very good testing. And so, we have remained below the national average. If you zoom in a little bit on Illinois, you kind of get a sense of this, but there is a lot of COVID. Across the Midwest, Illinois continues to actually have the lowest rates. In purple there you see at approximately 56 per 100,000. Michigan, Minnesota, continuing to have the most significant outbreaks at this point, but the Midwest is on the rise, and case rates have tripled in Illinois since the beginning of November. Lots of questions about what are we seeing with Delta and Omicron, et cetera. So across Region 5, which is Illinois and Indiana, Michigan, Minnesota, Ohio, and Wisconsin, virtually everything we're seeing is still Delta for now. 99.9% are Delta. And Omicron, there have been some scattered cases, including here, but still in terms of percentage, it hasn't even hit 0.1%. So We will keep you updated with that, but this surge is very much Delta. If you put our Chicago numbers into the community transmission and risk matrix, again, when we're over 800 cases, we're at 903. We are in that very high transmission, very high risk status in terms of being out and about, and there being people who have COVID and don't know it. Our test positivity, because we're testing a lot, is still under 5%, which is great. That's where we want it to stay. And then in terms of both hospital and ICU beds, you see in total we've got 441 folks in the hospital, but not in the ICU, and that has been growing actually quite quickly. And then 135 in the ICU with COVID, also increasing. And really, you know, again, I've talked about this, but I think it's important to see that in the same way we saw a change in a post-Thanksgiving bump and then a post-Christmas and end-of-year holidays bump, we're seeing something similar right now. And our test positivity does continue to increase, but much better than where it was previously. Now, some of you were wondering about, with the surge post-Thanksgiving, are we seeing changes in terms of who's getting COVID? I showed you over the last month what some of the age and race ethnicity has been. But also, this is just a comparison of Chicago cases by age group and race ethnicity. And on the top, this is the percentage of cases in each age group in Chicago. So in the 2 weeks before the Thanksgiving week, you can see the breakdown there. On the left, those are the percent of cases in 0 to 4-year-olds, and then 5 to 11s, and then 18 to 39, 40 to 64, and 65 plus. And then you see in the 2 weeks following Thanksgiving, not a lot of significant really shift there. A little more in the younger groups, but that's mostly because, again, the biggest risk factor continues to not be being vaccinated, and I'll show you that data in a second. And then on the bottom, the percent of cases in each major race ethnicity group, and again, you can see no major shifts there. So the whole city really, ages, race ethnicities, neighborhoods, the whole city is increasing, and risk is increasing everywhere. Now, this is what I really want to highlight. You know, we've continued to share these and post these online every week, but I wanted to point out, really, since Thanksgiving, you see that sharp increase. And just in Chicago, just since Thanksgiving, yes, we are seeing some more breakthroughs. That is the dark blue line there. You can see that's at the highest that it's been. It's part of why boosters are important. But so much more driving this is that huge increase in the unvaccinated. And just since Thanksgiving, infections are 3 times as likely in unvaccinated Chicagoans. And if we look at hospitalization rates, it's even more striking. And this is where I really get sad, because the vaccine does a really good job still of protecting people against these severe outcomes, hospitalizations and deaths. And you see, not unexpectedly, when we have increases, we do see some more hospitalizations, especially among people who are older with underlying conditions, especially immunocompromised. But boy, that unvaccinated is shooting up. And just since Thanksgiving, Chicagoans who are unvaccinated 5 times as likely to be hospitalized with COVID. And to make the point about age here, breakthrough COVID hospitalizations do remain very rare in Chicago, but where we see them, they tend to be in older Chicagoans, especially with underlying conditions. And so if you look, in this graph, we compare on the left versus the right by age, all Chicago cases on the left that are unvaccinated and hospitalized, and on the right, all Chicago cases that are hospitalized with COVID and fully vaccinated. And so you see here, first of all, these numbers are a lot higher on the left across all age groups. The gray here shows you Chicagoans over 60 getting hospitalized who are not vaccinated. That is the biggest driver in our recent hospitalization increase. Right behind them, 30 to 59-year-olds, 18 to 29-year-olds, and then younger. On the fully vaccinated side here, you see these rates have really remained very, very low, but where we have seen some more breakthroughs, it is in that 60-year plus group, and that's part of why really encouraging folks, but especially older folks, people with underlying conditions, to get those boosters. And death rates, just the same thing. Look at that. The fully vaccinated death rates are holding pretty stable, but look at that big increase in the unvaccinated rates. Again, Chicagoans, just since Thanksgiving, 5 times as likely to die with COVID than those who are fully vaccinated. And same thing on the age group here. On the left, these are unvaccinated Chicagoans who have died. On the right, these are fully vaccinated Chicagoans who have died. And since Thanksgiving, older Chicagoans, 60 plus, 7 times more likely to both be hospitalized and die than vaccinated counterparts. So if you know anybody who's still on that left side, perhaps some of this data could help encourage them. Reminder, we've had 0 deaths linked directly to COVID vaccine here in Chicago, 0. Per the medical examiner, per the health department, and unfortunately, we still see 5, 6 Chicagoans every day dying with COVID, almost all of those unvaccinated. Here's the actual data on breakthrough cases. Still, 98.5% of fully vaccinated Chicagoans have not subsequently tested positive for COVID-19. Trust me, there are a lot more breakthroughs and we're hearing about them. And to put this in some perspective, you see at the bottom there, we have had almost 25,000 breakthrough cases, which is a lot. But that is out of 1.7 million Chicagoans who are fully vaccinated. It's still just 1.5%. And more importantly, more than 99.9%, 99.97% of fully vaccinated Chicagoans have not been hospitalized with COVID-19 after getting vaccinated, and 99.99% have not subsequently died due to COVID. You see, we have had 575 COVID-related breakthrough hospitalizations. We're investigating some more, and we've had 147 COVID-related deaths in folks who are, who have been vaccinated. But in terms of the most important thing to protect yourself, this remains more important than everything else put together. It really does. And in parts of the world where we've seen virtually everybody get vaccinated, we've also seen virtually nobody get hospitalized or die. And that's where we want to be. Lots of Omicron questions, so I thought I would tell you we're still learning about it. We have partners at Bluebot who help pull data together, and here's where we are thinking this is likely going to go. I do think that Omicron is likely to spread quickly. We have pretty high confidence in this. I shared some of that data with you last week, but we're seeing the Scandinavian countries now really expecting probably within a few days that will look like South Africa in terms of being the majority. We're still following all of that, but I do expect the early data suggested this is probably, maybe 2 to 2.5 times as easy to spread, as contagious as the Delta variant, and we're still learning about it, but we're feeling pretty confident that it probably will spread relatively quickly. We're also, unfortunately, feeling pretty confident that we will see some more breakthroughs and reinfections. We do think at this point vaccines are very likely to continue to protect against severe disease, but because there will be probably more transmission, that makes it harder to control efforts and it puts everybody at some more risk. We're watching Israel and UK data really closely. We're analyzing laboratory study results, which are still coming, but that's what we think is most likely. And still a lot of questions about case severity. You see, we said we have low confidence right now in terms of having been able to see enough data about severity. We think based on what we're seeing now, Omicron is unlikely to be more severe than Delta, which is very, very good news. But I'm still skeptical of claims that there's significantly reduced severity. So great news. It doesn't look like it's making people sicker than what we have now. But I do know there are a lot of people who feel like this is really not making people sick at all. And that is not yet something that my team feels that the data shows. And some of this is because we're still collecting Omicron's new, we're still following people as they get sick and hospitalized and die. So I want to just be clear, we're still, cautiously optimistic there. But the problem is if the top 2 come through, it still is an issue. And again, especially for folks not vaccinated. Boosters we think are also going to be important. So what we're anticipating we might see here kind of worldwide is that, we have two populations by and large, sort of immune populations, which include people whose immune systems have learned lessons from COVID. Ideally, they have been vaccinated, somewhat less ideally, but still with some level of protection if they have recovered from COVID. Still, the best protection out there is people who both recovered from COVID and had and were vaccinated. But in some of the early studies of Omicron, we see a drop-off of antibody levels, a big drop-off of antibody levels in all of those groups. So we do think we will probably see greater breakthrough infections, but hopefully still predominantly mild illnesses, especially in people with protection. But we still have a large, completely susceptible population here. More than, I think we're approximating now about 650,000 people just in the city of Chicago who have neither been vaccinated nor, when we look at the population level, have any evidence of antibodies, from quote unquote natural infection in their blood. And we do think in those susceptible populations, we will probably see accelerated transmission and then rising number of hospitalizations for severe illness in that group. So still learning, but that's what we're thinking right now. And we will obviously continue to update as the studies come out, which will happen over the next week or so. In preparation for the upcoming holidays, really the main messages always are to get vaccinated, but please strongly encourage you to get booster doses if at all possible before the holidays. We've ordered additional vaccine here to have it more available and want folks to use it. Would also strongly encourage using rapid tests prior to participating in gatherings and parties, especially if everybody's not fully vaccinated and boosted, and then just making sure you're maintaining and improving other mitigation steps where you can. Booster doses of Pfizer's COVID-19 vaccine are recommended now for 16 and 17-year-olds at least 6 months after the initial vaccine series. So that means everybody in Chicago over the age of 16, if you're 6 months post your Pfizer or your Moderna vaccine or 2 months post your first J&J vaccine, we do recommend free, widely available boosters. Vaccine administration is up again, which is good to see. We're back up to over 100,000 doses per week just here in Chicago, the highest we've been since May. Most of those continue to be done in pharmacies, which we encourage, as well as in outpatient settings, federally qualified health centers, hospitals, our community events, urgent cares. We've also seen some more increase in boosters. We've seen a drop off around Thanksgiving, and that's been good. We've got about 440,000 Chicagoans who have had that booster dose already. We are a little bit ahead of the country for booster doses, but still in the adult population over 18, we're nearing 30% have had a booster dose. I'm more concerned that in the over 65 population, we're still at only about half that have had a booster dose. So it's a recommendation. It is not a requirement for public health purposes, whether you're trying to get into a theater, whether you're needing to get vaccinated for work, but it does help. And then people were wondering, where are we seeing increases in booster doses? And the nice thing is we have seen more booster dose uptake the most in older Chicagoans. Up at the top there, you can see the largest increase. The little box shows you what was the percentage increase since last week, and our 30 to 59-year-olds actually had the biggest increase last week, but we've had the most people in their 70s and 80s haven't had that first dose. We're doing some extra messaging where we're seeing lower booster uptake right now for adult Latinx Chicagoans who are due. So continuing to follow some of this and adjust messaging. Also, we continue to do case investigation and contact tracing whenever anybody's diagnosed with COVID, and the team does collect a lot of information if Chicagoans are vaccinated or not. If they're not, why not? And here in Chicago in recent weeks, early November through early December still, the most frequently specified reason for not getting vaccinated continues to be these safety concerns. And so, if you have safety concerns or you know people who do, please be sending those in because the safety data is really good on this vaccine. And you can see religious reasons are extremely low, in the 2% range across the board. And we see some medical conditions. So you can explore this if you like, but we continue to try to message around safety. And then when we look at unvaccinated interviewees age 65 plus, they often continue to cite concerns about other medical conditions, or they cite a provider's advice. And so again, really, if you look at that 65 plus group, which is right here and the fourth one over, you see that red group, medical condition or provider update, is much higher. And I strongly, if you know older folks who have not gotten the vaccine and haven't because of a medical condition, to make sure they are talking to the providers who take care of that condition. Our Protect Chicago at Home is going really strong. It is available now 7 days a week. We up to 10 people can get vaccinated at the same time. I wanted to highlight that, if you're making a primary appointment for, a teenager, a child, an adult, we are happy to do boosters for mom and uncle and the neighbor and anybody. We can do all of that off one initial appointment. But we are doing appointments now, Monday to Sunday, 8 a.m. to 6:30 p.m. If you've got more questions, let us know. But we continue to be the only large city that does this. And that's partly because it's been in parts of the city that really need the most progress on vaccine, have really taken to this program. And we think it's critical that people are able to access, we get rid of every barrier that we can to accessing vaccine. So the last thing is tomorrow is the deadline to enroll for health insurance coverage, to have it start on January 1st. So we've been sharing this, getcoveredillinois.gov. If you know anybody who is not covered by health insurance, I used the marketplace when I was between jobs for just a month or two, a couple years ago. But open enrollment, if you've not had a change in job status, et cetera, is when people can sign up, and you miss that timeline, then you have a health problem. You can't just enroll retroactively. So strongly encourage people to take a look. There are, depending on income level, there are very affordable and even free plans available. So, and then finally, as always, if you need a vaccine or a booster, you have any questions, visit chi.gov/COVIDvax or call our number. So I hope that helped answer a lot of the questions that were already coming in, but let's turn more directly to some of your questions now. Thanks. Okay. All right, so question here as a, there was some news about the Pfizer pill that just released some data from its study this morning. So why don't I'll give you just a quick overview of what is happening with that, because that is front page news today. And it is something I am actually really think could be a big deal. Again, in terms of, we're not eradicating COVID, but having the potential for a medication with good evidence behind it that actually helps protect against hospitalization and death. So just to kind of take a step back, many of you probably know Tamiflu as an example of one of the medications that's been available for years, that if you are diagnosed with influenza and you're at high risk for hospitalization, death, and you see a doctor within the first few days of your influenza diagnosis, you can take a medication by mouth, and it really helps keep people out of the hospital, helps protect them from dying. And it's a tool that we use with flu vaccination to help keep people safe, to help keep hospitalization numbers down. And I've been hoping for a similar breakthrough, since COVID came. And there are two different companies, just to put this out there, that have put forward two different formulations that would be that same idea, that if someone is diagnosed with COVID and is at high risk for a severe outcome, especially if they're unvaccinated, but potentially as the studies are going on, maybe even if they are vaccinated and they're high risk, that you could take these pills. And the Merck trial, their antiviral reduced the risk of hospitalization and death from COVID-19. In the first in the initial stage, it looked like it reduced it by about 50%, which was good. In the larger study, it reduced the risk of hospitalization and death by about 30%, which is not nothing, but it is not as effective as honestly, we would hope. And so the advisory group to the FDA, this was about 2 weeks ago. There was actually I encourage you to look if you're interested at some of the science and the debate about this. The advisory committee did narrowly recommend approval here, but with, some caveats and questions. And it has been approved in Britain. France did not give it the green light. So it's not available at this point in the US, but the FDA may give it approval. We'll see. But just behind it is a medication. This one is made by Pfizer. And in this case, it works differently than the one that Merck has put forward does. This one doesn't actually work on the genetic sort of fingerprint, if you will, of the virus. Instead, it works on an enzyme. And to take you back maybe to high school biology, chemistry, an enzyme is something that it's not in your DNA, but it's what helps reactions happen. And so the COVID virus needs enzymes to copy itself. And so it's not that this pill stops you from getting infected. You are infected with COVID. You don't get the pill until you're infected with COVID. But you take it early in infection, and it works on the enzyme. And that, in turn, stops the virus from being able to copy itself so much. And it's when we see all of these copies, and it's sort of through your body and it's getting in your lungs, that we tend to see the really serious outcomes. And so one of the reasons I like that approach, going after the enzyme, is that we wouldn't expect it to be affected even if the virus continues to mutate. So in the trials were done in people with the Delta variant, but in the laboratory, it worked well against the Omicron variant too, and we wouldn't expect, because of the way that it works, it to lose its efficacy. And so in the trial, just to be clear, there were about 2,246 specifically unvaccinated volunteers who were at high risk of severe disease and got COVID. And in the first sort of part of the trial, the preliminary, if they took the drug within the first 3 days, it reduced their risk of hospitalization and death by 89%. And in the follow-up trial, that held basically. And even if they took it within the first 5 days, it reduced the risk of hospitalization and death by about 88%. So, and there's some specific questions. Pfizer said, and just the details on this, basically 0.7% of the patients who got the drug ended up being hospitalized within 28 days. And then in comparison, about 6.5% of the patients who got the placebo, the sugar pill, because remember, this is all done double blind in the same way that we always test drugs and vaccines. So that's where dropping the risk of hospitalization by more than 80%, big potential deal. And there's preliminary data. There's a separate trial looking at people with a lower risk. So as opposed to unvaccinated people with high risk of disease, they're looking at vaccinated people who have a high risk potentially because of underlying conditions of progressing. And they're looking at unvaccinated people without the risk factors. And in that group, in the preliminary information, it also reduced the risk of hospitalization and death by about 70%. So more to come here, but at least based on this initial information, I do think, as the advisory group is meeting, they'll be looking at safety data, they'll be looking at efficacy data, but I am optimistic that we may soon have a drug that can make a really big difference where people are still getting infected with COVID. It does not replace vaccination. It doesn't prevent you from being infected, but cutting that hospitalization and death. Some of you have heard me talking about this for a number of weeks now, but was really pleased to see that study, out. And more to come. I do think if this does get approval, if the safety data looks good, if it continues to hold up when it is released in terms of that efficacy, I do think there's likely to be a lot of demand. And there's some questions, how do I get the pill? Is it over the counter? No, this will be prescribed. by a doctor. It will be prioritized for people with underlying conditions for sure. So, where I think about where we most need this, it's people, who are immunocompromised, who are getting transplants, who are on, cancer medications that depress their immune system, are in nursing homes, are very high risk. But as we learn more about this, I think it has the potential to be a big deal, and I think it may be available, possibly even before the end of the calendar year. So we'll keep you posted, but that was very good news. Okay, another question here. Alexandria Deanne on Facebook, we're at a 2-week mark for Omicron now, I believe. What do we know as far as symptoms, vaccines, et cetera at this point? Want to know more as I prepare for holiday gatherings. Yeah. So that's why I sort of shared overall where we think we are. We don't have, I told you it was going to take a couple of weeks. We should have in the next week the more formal results from the different vaccine trials, also some more severity data. I can tell you here in Chicago, we are continuing to follow up on cases and contacts and settings where Omicron was seen, and we've not seen widespread, obviously, of Omicron. That's why I also shared that, really everything, 99.9% of what we're detecting right now continues to be Delta. But there will be some more coming. I think the severity data is more reassuring when I see it each day. But we're still learning there. So I think as far as holiday gatherings, for me, I want folks vaccinated. I want folks boosted if possible. For the young ones who haven't been eligible, that, assuming that their parents and guardians are, I welcome them obviously in. But then also, if you're particularly concerned, or you've got someone who's immunocompromised, or you've got someone who's not vaccinated, pairing that with, with some of the at-home tests, or they don't have to be at home, but at home are increasingly available and reimbursable, et cetera, that can also help with peace of mind. But I want you to gather. I've really enjoyed the ability to, I love theater, some of you might know, and I've been able to go to the theater. I've been able to, go to the Nutcracker. I've been able to go to some live music. These are settings where they're looking for proof of vaccination. Everybody's masked. It's being open, doing the things that we love are really important, and we want to do those in a way that helps limit the spread of COVID. And I really want that for your own holiday gatherings. Trust me, you don't want to be some of these families that we were talking to after Thanksgiving that ended up having spread, and in some cases because people had symptoms but didn't think it was COVID, or had a test result pending and came anyway, and then the test was positive later. That's not what I want for anybody. So when you've done all that you can do, especially around vaccination, to have settings as safe as you can be, I think it's okay to be gathering, but you should do that carefully, and we're going to see what happens. We'll keep you posted on Omicron for sure, but Delta itself is worrisome enough. Connie Tsang on Facebook, is Delta still the dominant variant in Chicago? Yes, it's in the slide deck. If you want to go back and take a look, we'll post that online like we always do. And the 99.9% of what we are detecting continues to be Delta. Deb Billow on Facebook, are the over-the-counter COVID tests reliable for use before holiday gatherings? I think they are. So let me just kind of break that down a little bit. The over-the-counter ones, and I presume by that you mean the at-home ones that you can take, like a pregnancy test, you get a result within 10 to 15 minutes. Those are what are called antigen tests, meaning that they are, they actually work like a pregnancy test. They're not looking for the genetic material of the virus itself. They're looking for, for a protein. And really those tests, especially if somebody has a COVID infection at a level, like enough COVID that they're potentially likely to spread it, those tests are generally positive. It is true that the PCR tests are a little more sensitive, meaning they could pick up COVID a little bit earlier. They stay positive longer, but honestly, for things like gatherings, especially, especially if you're doing it, day of even, or, within 24 hours of the gathering, you can feel confident that folks who are coming, even on the unlikely event they actually have COVID and don't know it, they are unlikely to have COVID at a level that they're going to spread it. If somebody's still got really bad COVID symptoms and they've had an exposure, like, that should, you shouldn't gather, right? Like if maybe the PCR is coming, et cetera. But I really like the over-the-counter tests. They are, if you actually look at the details of them, they're recommended to be used sequentially. So one of the reasons they come in a 2-pack is that really the recommendation is you would take one and then you would take another one a few days later, and that combination is good. But I think they help for sure. Nothing is 100%, but a combination of a fully vaccinated, boosted, and then even on top of it, if you want another level of protection, tested gathering is really the best thing that we have in terms of helping to keep settings as safe as they can be. It's not really feasible in most cases to be able to be outside. You're taking masks off to eat, et cetera. But we have had some holiday gatherings, for example, that have decided to have the masks on and have the, if people are making different decisions, but I know that people gather and they eat, and that's an important part of the holiday. And so, yes, I think they are quite reliable, and I encourage people to use them to add another level of protection if they're available. Nice lady on Twitter, I like your handle, says, how do I find a place to go for a COVID test? Chi.gov/COVID test will answer a lot of that for you here in the city of Chicago. There are COVID tests very, very widely available through all of the different providers' offices, urgent cares, COVID testing sites that have been set up. They're also available at pharmacies. They're also available, CDPH continues to have sites in partnership, especially in some of the the areas that are testing less, or we're seeing higher positivity. We also, just out of interest, I know this is not what you, nice lady, are asking about, but we do continue to test in high-risk settings, in shelters, in congregate settings, nursing homes, et cetera. There is a lot of testing. Obviously in schools, there is a lot of testing happening. But for you, please go to chi.gov/COVID test. I also really have been encouraging people to get some of those at-home tests. You can order them online from Walgreens or Target or Walmart or Amazon. And I keep them at home, and I do use them. If I have even a little bit of a symptom, there's been a potential exposure, they do give another level of peace of mind for me, and they're good. So that would be my answer. But check out online for the details, and you can look up where you live and see that. A number of the pharmacies have programs that even if folks are not insured, et cetera, you won't get a bill. So go there to see. Dr. Shaw on Twitter, what are your plans for making low-cost home tests available in Chicago? So this is why I'm really excited that the federal government has been doubling down on this. Right now, we actually, CDPH continues to order and pay for and buy the at-home tests. They're not as inexpensive as I wish they were, but it's not that we don't want to spend money on them. It's that when we order them, it literally takes many, many weeks for us to get them. So just to kind of give you a sense of this, we already are distributing them. We are in the door-to-door work that we do in the hardest hit communities. When we're doing the, some of the outbreak investigations and the follow-up, where there are testing needs that are being unmet. But also, like, for example, ahead of the Thanksgiving season, every alderman that wanted free at-home COVID testing, we made them available to their offices for them to be able to distribute. We've been working with community partners to make them available. So we have been working to get them available. And with the news that they're going to be ramping up production, that the private health insurances are going to fully reimburse the costs of these, all of this is going to help. And I'm hopeful that we will have, I'm most excited about the potential for an actual medication that can be we haven't had a fantastic, a medication that truly cut this in the same way. And, too early to say for sure, but I'm optimistic about that. But I'm also optimistic about the continued growth in testing accessibility. And then I think just as a last question or two, because we are nearly at time here. And I see, Gwendolyn Rose, I hope that hit your question about the rapid tests. Megan on Facebook says, I keep hearing about the at-home vaccination program. It looks like it's booked up. I really want to get my parents their booster in addition to an additional dose for my nephew. Okay, good question. So a couple of points on this. We follow really, really closely how signups are going for the at-home vaccination program. We actually track it by region of the city, and we have more appointments available for people getting their first and second doses than we do booster doses, just because they remain the highest risk group. And I've actually been really pleased that we continue to see the majority of our doses still going to people who are right now getting their first dose of vaccine. But there are some booster doses available. I want to clarify that typically, if you go to try to sign up for an at-home vaccine, you're not going to be able to find an appointment for about 4 to 5 days. And that's because in the 4 to 5 days, I think 4 officially, but just to kind of give you a sense, we close further signups because that's when the team is doing all of the follow-up with folks who have signed up to make sure they actually still want the vaccines. They are seeing other neighbors who want to get it. We're actually setting up and making sure we have the cold storage in place. We want to know which vaccines people want, just to make sure that people who are participating in this program, we are sending these teams out to, 1,200, 1,300, more than 1,000 locations a week. We want to make sure where we're doing this, there are people who are expecting that appointment. And we've seen our numbers go up in terms of the number of people getting vaccinated. So I would not expect that you can call today or that you can go online and book and that you will have an appointment today or tomorrow. But would you be able to get an appointment next week? Yes. Would you be able to get an appointment 2 weeks from now? Most definitely. And if you've got an initial dose for the nephew and the parents want a booster, you only need one appointment there. Make the appointment for your nephew, because that's one of the presumably primary doses. And then as you are filling out the information there, we would like nothing more than to boost your parents or to give your neighbor a vaccine. We will do 10 people, no problem. You don't need individual appointments for each of those, but you do need that actual primary appointment. So I hope that clarifies it. It's not booked. We've got availability, but it always is going to be a few days out, just by the virtue of how the program works and to make sure people have good experiences with it, which they have. All right, a lot of questions we didn't get to. Please tune back in on Thursday. Today was the day that we gave you a lot of the data. We'll have some more time for your questions on Thursday. And we also, I believe, are going to have someone from our maternal, infant, child, adolescent health program on to talk about some of the COVID-related, but also some of the additional ways that we're really growing some of that work. And it's something a lot of you have been interested in. So if we didn't get to you, please try to tune back in Thursday. We'll post the we'll post the data from today. And please, do share with anybody over 65. 1 in 100 Americans have died from COVID who are over 65, and we still have a lot of unvaccinated older Chicagoans. And I just want them and all of you, everybody, to be able to celebrate the holidays and gather without that, doing everything you can to mitigate that risk hanging over the celebration. So thanks for tuning in, and we will be back on Thursday. Be well.